If you're a physiotherapist, you may visit them once a day for about half an hour or so. Well, you've got nurses working with you largely 24/7 if you're in hospitals, and very regularly if you're out there in the community. So we tend to take on a coordination role between all the other NHS services, because we're the ones who tend to know the patients better than anybody else. And we interact, as I say, with doctors and physios, pharmacists, radiographers, occupational therapists, healthcare assistants, and many more other services that the NHS offers. Now, why do people become nurses? Well, I did it for particular reasons all those years ago. I must admit, it was a bit of a spur of the moment decision for me, but it was one of the best decisions I ever made in my life. I thought I'll go and be a nurse because I had a plan, and I'll go and be a nurse because I'm quite clever and it'll be quite easy, and then I'll go and do what I want to do once I qualify. And then I realized very quickly, usually within about 3 or 4 weeks, I think this was, that I learned 3 really important lessons. Firstly, I was nowhere near as clever as I thought I was. Secondly, it wasn't easy, it was incredibly difficult. But thirdly, and this is the most important lesson I learned, it's one fantastic job. I've never done anything in my life, and I did lots of things before I became a nurse, but I've never done anything in my life career-wise that's given me the job satisfaction that nursing has done. Because as one of these students in the PowerPoint says, nurses help people to improve, maintain, and sort of control the best quality of life they can. Ideally, yes, we would like to fix every problem that we come across, but there are many problems out there that we can't fix. But what we can do is allow that patient to be as independent and the best possible version of themselves that they can possibly be, given the limitations of their condition, whether that be life-limiting, such as something like a cancer, or whether it's life-debilitating, which is there's many conditions such as multiple sclerosis or rheumatoid arthritis or things like that, COPD. There are many conditions that fall into those categories. But if we can't sort of help them fix the problem,
I can't even see my own eyes in the mirror. Yeah, I can still see.
I think somebody's got their microphone on. Yeah, so we try to make them give them the best possible quality of life that we absolutely can. To be a nurse, you need lots of qualities, and you may have heard about the 6 C's. This is something that the chief nurse for the NHS launched in 2012, but it was valid even when I was a student nurse, and it remains valid today. And it's all those qualities that nurses need. And one of the biggest qualities they need, I think, is compassion. Now, if I was to ask all of you, what do you think I mean when I say compassion? There's about 40 odd of you on this chat today, so I reckon I've come up with about 40 odd different definitions of the word compassion, because it means different things to different people. But it is fundamentally, it's about that ability to not sympathize, but empathize and put yourself in the position of the patient and understand what it is that they need to develop and what it is they need to do to progress within the boundaries of their condition. Nurses need a lot of skills, we need a lot of knowledge, and we need a lot of ability. We will provide a lot of this in the university as far as the actual skills and techniques are concerned. But as a person, what you really need to be is organized. You need to be flexible. And most importantly, you need to be observant. You need to be able to determine by looking at patients whether you've got one that looks like they are going to be okay, or whether there's something that worries you about them. We talk about this as the nursing intuition, and this is something all nurses develop over a long period of time. It won't happen in your 3 years as a student nurse. It normally takes an awful lot longer than that. But eventually you'll be able to look at a patient and think, well, their observations are fine, but I'm really not happy with them. And generally your intuition will be correct. It's one of the characteristics of an expert nurse, and most nurses move towards that at the end of the time. But we will teach you all the skills and things you need to actually understand how to develop those skills in yourself. I'm going to skip forward a few on these things. I've got a few quotes which we'll put in at the end, but you're going to be talking to a lot of my colleagues, a couple of my colleagues later on, and they'll give you their experiences. Now, where can you go with nursing? Well, we kind of like it to stay in the NHS if possible, but you're not really limited by that. Now, there are lots and lots of things that you can do as a nurse. So as an adult nurse, you can work in lots of different areas. So I mentioned the acute settings and some of the acute areas in the acute hospitals. So what I mean by acute is rapid onset, rapid development, and then rapid management. We tend to associate these things with like intensive care, cardiac wards, theatres, accident emergency, things like that. But there are also a lot of other specialties which are still acute. So acute medicine for the elderly. Oncology can be acute in the early stages. So there's an awful lot of things you can do in the acute side of things. But once you move away from the hospitals, as I mentioned, a lot of the things you can do in the community. But we also work in nursing homes, prisons, hospices, and all the ones I mentioned earlier. And on the list here on the PowerPoint, and we will send it to you so you can have a look at it, but it says cruise ships. And I lost one of the best charge nurse sisters that I ever had working for me when I was a manager. And she went off to work on a cruise ship because she had no real personal commitments. And it was the right thing for her to do at the time. And I was incredibly jealous because I'd love to do that. But I have my personal commitments, as I guess a lot of other people did at the time, and I wasn't able to. But as somebody who used to enjoy my cruise holidays, I used to interact an awful lot with the nurses on the ship because nurses do tend to flock together. Now, I'm going to tell you a little story for a minute. A friend of mine called Ben. He's a guy I trained with back in 1985. I met him on the very first day of my course, and we became friends, and we've been friends ever since. Like all friends do, especially nursing friends, you do sort of wander in and out of contact with each other. And I did lose him for a little while. And one of the things that brought it back to me was I was the manager of an A&E department. I had a knock on my door one day, and I answered the door, and there's Ben standing there. And we had a lot of chat about what are you doing, and he was quite impressed that I'd managed to work my way up to manager. I said, well, what have you been doing, Ben? I haven't seen you for several years. What have you been doing? He said, oh, not a lot, really. He said, I'm just a staff nurse. I went, yeah, okay, so doing what? He said, well, I'm still in oncology, cancer care. He said, but yeah, after we left our training, he said, I worked for a little while, and then I went for an interview in one of the hotels in London to go and work in America. And he said, I was in California for about 18 months. And then after I came back from California, I saved up for another year or so. Then I went to South Africa, and he was in South Africa for about 2 years. And he said, I'm back now working for Macmillan again, and I'm hoping this time next year to go to Australia. Now, that was late 90s, 1999, I think it was. And he did go to Australia. He is now a naturalized Australian citizen. He's married to an Australian lady. He's got a wonderful, I think she must be a 12-year-old daughter by now. And he's a senior nurse specialist in oncology in Australia. So there's not an awful lot of things that you can't do with your nursing qualification, because your nursing qualification will give you two things. It will give you the ability to register with the NMC, which is one of the most important things. And that allows you to work in, I would say, probably about 2/3 of the world. The American one is a little bit tricky because they ask you to do an entrance test. But a lot of other places in the world, they will accept that NMC registration because they recognize the quality of that. You will also receive a BSc honours or a diploma, depending which course you're doing, but all the registered nurse ones are BSc honours. Excuse me. And that will give you the academic qualifications to go and work again almost anywhere. Now, I mentioned earlier that we would like you to stay in the NHS because people like myself who are getting on a bit now, bits of me don't work as well as they once did, and I'm looking to people like Yolanda to look after me in a few years' time when I start to get into trouble. So all the student nurses that I've trained over the last 20 years, I'm going to probably meet them again from the other side of the fence at some point, because that's the way it happens when you get a little bit older. But as I say, if you want to go outside the NHS, there's 1,000,001 different things you can do, and a lot of different countries you can go and work in. If you want to be a child nurse, there are, again, lots of options within the child nursing field. Yes, of course, you can work on the children's ward, and there's a lot of fly-on-the-wall documentaries about places like Jimmy's in Leeds or Great Ormond Street and places like that. But there are also children's community nurses. There are nurses working in mainstream schools. We have children's centres, special needs schools. Health visiting is another option for you once you're qualified. Again, practice nurses in GP surgeries. We have paediatric nurses in the emergency department now, and neonatal intensive care. I just want to give you a little word of warning, though. There's a difference between child nursing and midwifery, and this is something that's not always appreciated. If you like to look after ladies who are pregnant throughout their what we call the perinatal period or postnatal period, then I think what you need to look for is midwifery. If you like to look after children, you want to be a child nurse, because midwives don't look after an awful lot of children. In fact, they only see the child for about 2 weeks, and that's usually from birth to the 2 weeks later. All the rest of the time, their focus is on the mum. So if you want to look after children, go for child nursing. If you want to do midwifery and childbirth, then you go for midwifery. There's a lot of a difference there. And mental health nursing, again, is a vast field. And if you watch the news at the moment, you'll see there are a lot of mental health issues developing over the last 12 months, more so than we have seen in recent years, probably due to the problems caused by the pandemic. But again, if you're a mental health nurse, we've got acute inpatient wards. We've also got community teams, and again, those go right across the age range from adolescents all the way up to the elderly. We've got crisis teams who will manage people in the community when they're having, say, a long-term mental health problem and they're having a crisis in that, whether that be a depression or whether that be a bipolar crisis. We've got a lot of people who look after patients in that situation. I've got mental health nurses who specialise in things like eating disorders, or liaison teams with other specialties, and along with something called forensic science. Now, forensic service and forensic science in mental health doesn't mean what you think it does in the criminology side of things. It's a completely different field of mental health nursing. But again, it tends to be more in the independent sector, but it analyses the causes and management of these conditions rather than the exact patient itself. So whichever field you go for, there are lots and lots of things you can actually do. Now, apart from all the good reasons I've just given you why you should be a nurse, there is an overridingly good reason why you probably want to be a nurse. And one of the reasons is in 3 years' time, the NHS will pay you. And depending on your circumstances at the moment, that can be actually quite a large pay rise. So basically, to start, with no enhancements and no unsociable hours or anything else, currently today, it's around about £23,000 a year. I see that going up by the time that you guys qualify, because there is an awful lot of politics involved at the moment. And as I say, nursing has a very high profile. So I suspect there will be some investment in that side of things. But that can go all the way up to about 29,000 for what we call a band 5 nurse, which is a newly qualified nurse. Again, it rather depends where you work, who you're working for, and what sort of hours you're actually working. Obviously, the unsociable hours tend to generate a little bit more of a salary. But then from there, you can work your way up through your career ladder. You can decide what you want to be. Now, all the courses that we offer at Anglia Ruskin will give you the opportunity to experience lots of different types of nursing within the field that you've chosen, child, adult, mental health. And you'll be able to make an informed choice at some point over the space of the next couple of months. Next couple of years rather, to decide what sort of nurse you want to be. And at the end of the course, you'll be able to make that informed choice about where you'd like to work. But beyond that, you can then start to go into specialisms. You can look at maybe going from a junior staff nurse to a senior staff nurse to a charge nurse to a matron. Then you can look at, do I want to go to management? Do I want to go to education? Do I want to go to support services? And the opportunities are vast, really. You can climb the ladder relatively quickly. From qualifying in 1988, I was a nurse manager of an A&E department within 9 years, and that's admittedly very quick, but it is possible. It's something you can do. Once you get into these higher realms of nursing, the salaries go from anything from sort of £40,000 to £50,000 a year. So the opportunities to earn a decent salary while doing one of the best jobs, I think, in the world is important. Why do I think it's the best job in the world? I'll say, well, it's nothing that's given me the level of job satisfaction that nursing has given me. And the reason I get that is I've done nothing else in my work, in my life, where I can go home at the end of the day and say, I made a difference. I made a difference in some person's life. Now, I'm not talking about large dramatic differences. Although working in an A&E department, I have actually done that. I have resuscitated a patient, etc., etc. But those are very, very few and far between. They don't happen very often. But even where you've got a patient who isn't going to make it, who is at the end of life, you can still make a difference to them and a difference to their families just simply by being there. A gesture, a word, the fact that you are there, that you understand, that can give them a lot of comfort in those times. And all the criteria in between those, from the acute stuff to the non-acute stuff, It all gives you job satisfaction. You never go home at the end of the day thinking, well, that was a waste of time. You always go home thinking, yeah, it wasn't a great day today, but I made a difference. And I think that's quite important. That is significant for me. Now, I'm going to be brief on this because I'm going to hand over to my colleagues in a second. But if you want to join this group of like-minded individuals, these nurses we have out here, then basically you'll need to apply to us through UCAS. We offer several different types of nursing course. I mentioned child, adult, and mental health. Those are 3-year degree level programs. We also offer 2 4-year programs, which are dual qualifications. So you get to do adult and mental health or child and mental health. So we have those as well. That's an extra year, obviously, because there's an extra qualification that goes with that. And that might come in handy in certain areas where being dual qualified is a benefit. We also have things called associate nurses. Associate nurses are bridge the gap between the healthcare assistant and the fully qualified nurse. I won't say qualified nurse because associate nurses do hold a qualification and they are registered with the NMC, but they bridge that gap. And it may be something you want to think about in the short term or the long term. It rather depends on your own personal circumstances. So once again, if there's any questions about these and you want to delve into what it is you think is the right one for you, then please do get in contact with us. We're more than happy to have a chat with you at all times. So you need, to be a registered nurse, you need 96 UCAS points and 3 GCSEs, which is grade C or above, or equivalent. We do take level 2 equivalents as well, but they must include English and maths. Okay. Once you have met those entry requirements or are meeting them, if you expect to be complete by, say, September next year, you can apply to us and then we'll hold an interview with you. These are usually something called a multiple mini interview where you get to meet 3 different people in quick succession. At the moment, it's all being done online, but the process is very, very similar. So you have to, this is an NMC requirement, you have to attend a face-to-face interview. So if it's online, we do need to see you on a camera and things like that. But hopefully sometime at this point in the new year, we're hoping to get back to a face-to-face interview. And I know Yoanda's been helping me with some of those, so she can advise you what the interview is like. It's not actually terrible, and we try to make you feel it as much at ease as we possibly can. It's stressful enough without us being deliberately awkward. We try and make it as easy and as helpful as we possibly can. Okay, so I'm going to be quiet for a minute, and I'm going to hand over to Jodie and Yoanda. Yoanda, do you want to go first? Do you want to just tell us a little bit about what your experiences have been like? Yoanda's a second-year nurse at the moment.
All right, can you hear me?
Yes, we can.
Yeah. All right, I'm Yoanda. Hi, I'm a second-year student adult nurse, and yeah, I started last year, September. As soon as we started off with a bit of lectures, theory, so doing some theory work. Then we were put into placement in November, so we had our first ever placement, and we were all together. So all child, mental health, and adult had the lecture. We all had our lectures together in the first year, which was fun because you can see everyone else that's on the same course as you. You can speak to them of how your course is going. You can see how they're different and stuff like that. But so far, I've actually really enjoyed the course, and I picked nursing quite last minute, so I didn't expect to enjoy it because I was just originally supposed to go down the pharmacology route, but then I decided I didn't really want to do chemistry like forever. So yeah, I decided this, and I've really liked it. Like I really like it because like my mum, my sister are nurses, so I was just like, let me just do nursing kind of thing, just play it safe. But I actually really like it, and I've really been enjoying it, and all the different placements as well. Having so many different experiences on placement, like being on different wards, is really enjoyable and rewarding as well.
Yeah.
Yes.
So, how did you find the placements, Yoanda?
Yeah, they're all really different. Like my first ever placement was a surgical placement. That was really fun because I was on a surgical ward. That was a private hospital actually. And it was fun because one of the nurses let me go in to watch the surgery with one of the consultants. And I literally stood next to him as he was operating on the lady. Like he was doing it was a plastic. So yeah.
Excellent, thank you.
Yeah.
Jodie, do you want to tell us a little bit about child nursing?
So hello everyone, my name is Jodie and I am a second year child nursing student. Like what Yolanda said, it has been a really good experience thus far. I personally enjoyed placement, and I have my first second year placement in 2 weeks' time, which I'm looking forward to. I'll be going to the neonatal unit. I must say everyone's experience is different. You might have some people that might not be too keen on the placement area, but my advice would be to just go with an open mind and just seize the opportunity, really. Yeah, but it has been really good thus far. And in regards to the university experience, I must say the lecturers have been really supportive. And, you know, you have a lot of support. You've got the well-being team. If you're a person of faith, like myself, you also have support from that side. So, yeah, so it has been really good.
Just to pick up on that, as I said, we will try and expose you to as many different types of nursing within your field as we possibly can to give you that informed choice at the end of the course. And I see this time and time again, and I remember it happening to me as well. You go into a placement, you think, this is fantastic. I want to do this when I qualify. I'm going to love this. And then you go into the next placement and you go, no, change my mind. This is better. I want to do this. I'm going to do this now. And then you go into the third placement and you go, there's no way am I doing that. Because there are lots of different types of nurses, because there are lots of different types of patients. As I say, I'm an acute care nurse, so I like the hustle and bustle and the speed and the but the payback to that one is I don't get to really get to know my patients, whereas other types of nurses like to spend a lot of time with their patients and look after them over the space of several weeks, and they like that different sort of pace, whereas they wouldn't like what I do. So I can't say what sort of nurse you would want to be, and I guess you probably can't either at the moment, but by the end of the course you probably will. And I will say to you, we have got one of the highest what we call employability rates in the NHS at the moment, and that is around about 97% of the students who graduate on the nursing programs, all of them, will be offered a job in the trust that they have their clinical placements in. So usually by the end of the second year, people are now starting, you go on to one of your placements and one day the sister will sidle up to you and go, got some vacancies coming up. When you qualify, I want you to apply. You guys probably aren't quite there yet, but you're not going to be far away. So you'll get those job offers sort of surreptitiously coming in. But even if it's not what you want to do, you are more than likely to get a place in that hospital. So 97% of the people who qualify, we are almost guaranteed to place them in that area. The 3%, generally, that if they're going somewhere else, they're doing something else, and that's absolutely fine as well. But that employability is really quite important. Okay, I think it's over to you now, really. What questions can we answer? Myself and Yolanda and Jodie, what can we do for you? What do you want to know?
Could I ask a question while the students are thinking?
Of course you can.
Okay, so I work for the careers department, and I've met a huge number of students over the years that want to do medicine, and obviously a number on this call, and a lot of them, I'm sure not these ones, will say, I want to be a doctor because I want to be the one that makes the decisions, and I want to be the one in charge. How would you respond? Do nurses make decisions?
Absolutely, they make decisions. They make most of the decisions, in fact. It's a different specialty. Clinical decisions made by doctors are based on diagnostics, and they are very, and I don't want this to sound harsh because I've got a lot of friends who are doctors and they're great people, but they tend to be focusing, they're illness injury focused. They tend to be looking at the condition, whereas nurses look at the person. And I think that's the key difference. And while the doctors may prescribe treatments, We have to deliver them. There's things we call them the art of nursing and the science of nursing. The science of nursing is what we have to do, whether that's dictated by a doctor, whether it's dictated by ourselves, or what. This is how the heart works. The heart is the heart is the heart. It doesn't change because of who we are, what we look like, how tall we are, how short we are, whether we're male, female, or anything. It works exactly the same in all of us. So the treatments for heart conditions tend to be very similar. But how you actually apply those treatments, that's the nursing art. That's what we call the aesthetics of nursing. And every nurse you'll meet will apply that treatment in a different way, because it's as much about you and your personality as it is about what you need to do, and of course the patient. Gone are the days when we do things to patients. We now do things with patients, and the patient is central to the decision-making process. And we as nurses are the patient's advocate. We will not let something happen to the patient without the informed consent and understanding that the patient has of what it is we need to do and why we're doing it. So yes, absolutely. We tend to probably make more decisions than their doctors do, because there are a lot more things that we are involved in. We've got a much broader remit on managing our patient care than the doctors do, who tend to be, again, very specifically biomedically focused. Now, that's not putting down doctors on medicine. It's a vitally important part. But remember what I said right back at the beginning. The NHS is a collaborative organisation. No one part can work without the other parts. Nurses can't work without doctors, but on the same token, doctors can't work without nurses. Does that answer your question?
Yeah, that's a brilliant answer. I'm glad we've recorded that. There are a couple of questions in the chat.
Go for it, yeah.
So we've got, what are the benefits of taking a dual certification? I'm most interested in adult and child.
Okay, the dual certification is still, at the moment, is at BSc level. So you'll come out with a BSc honours, both in adult and mental health, or child and mental health, depending which way you go. And the benefits are, depending on where you want to work, having an insight into both aspects of care can be absolutely invaluable. And I'll give you an example from my background, accident emergency. When I was a clinician, when I was out there as a practicing nurse and as a nurse manager, we had mental health people working for us, and we also had the odd pediatric nurse who used to come up and help us out when we needed them. But having somebody in the department who was mentally health trained and adult trained, or adult trained and pediatric trained, would have been able to deliver a much more holistic care to a larger range of patients, because we don't really have the funds in the NHS in many places. There are some paediatric A&Es out there, and there's one not far from us in Essex. But basically, adult nurses looking after children, ideally you want a child nurse looking after children, but we don't know who's going to come in through the door. So we don't know whether the next patient is a child or an adult. We don't know whether the next patient is an adult with mental health problems or a child with mental health problems. So to have that extra ability will demand a higher salary, for one, and I'll keep coming back to that, but it is kind of important. It's not the reason we do what we do, but it's one of the reasons we do what we do. And again, the options for your practice later will be much wider. The payback for it is it's an extra year. Now, we are hoping to develop this. This is very new for us. We only launched the first delivery of this back in September, and we are hoping to upgrade that year 4 from level 6 to level 7, which is master's level. But that may take us a year or two to get approval for that. So eventually it will become a master's course. And if you're already on it, then but you haven't started year 4 yet, then the opportunities to upgrade to that will be possible. Because basically the first year is at what we call level 4, which is description plus. Level 5 is the second year, and that's where we start talking about discussion and introducing you to analysis. Year 3 is level 6, which is critical analysis, and year 7 is master's level, which is yet another step higher again in your critical thinking and critical understanding. So the options for having a master's is I won't say it's definite at the moment, but it's looking very likely that we'll develop that year 4 into a level 7 year. So those are the options basically, and those are where you can go with it. Imagine if you are working in the prison service and you've got mental health patients with, say, drug dependency problems. There's a mental health aspect to it there, but there's also a physiological aspect to it there. So having a dual qualification would be useful in there as well. And anything else? Any other questions?
Yeah, there's a couple of other questions in the chat. So Chanel was saying that she watched a video about nursing, and apparently there's a lot of bullying towards the younger nurses from the older nurses.
Oh, well, that's something we don't condone. I don't know which video she's actually referring to, but that is not, and it's not my experience of nursing, both from a personal point of view and from an academic point of view. But there are very, very strong mechanisms throughout the university and, in fairness, throughout the hospitals and trusts as well to prevent that. If that sort of thing does happen, we do come down on it very, very quickly. I won't say it's not happened, but what I'm saying is it doesn't seem to be prevalent. It's not it's not the norm, shall we say. You can never legislate for every circumstance, but it's not the sort of thing that I would personally condone. And the trusts take an extremely dim view of this, because what we need as an employer, that's the trust that is nurses. And what I want as somebody who's now approaching his 60th birthday in a year or two's time, I want people who are wanting to be nurses and wanting to be nurses for the right reason. We're not going to put them off by being difficult with them. That said, there is a other side to the coin as well, where we do have standards and we do have regulations to maintain, and students must meet those standards, and there are assessments in practice, and it is important that they do meet those assessments in practice. So if they're not able to meet them, then they don't proceed until they have passed them. So obviously that can put a perception on it, but certainly if any case of bullying that goes on, if it's with one of our own team, that is very, very rapidly policed. If it's in the trusts, we've got a very close working relationship with all the trusts who accommodate our students. I link with Southend Hospital, for instance. All the tutors link with one hospital or another, and I've got a very good working relationship with the practice team at Southend University Hospital. And if any of that sort of thing did go on, I can honestly say and put my hand on my heart and say that would be taken through a serious disciplinary on behalf of the nurse who got involved in that. We support you from a tutor point of view. We support you from a linked lecturer point of view, which is that connection with the trusts. The trusts themselves have a practice team, which they work for the trust, but they're there to support the students. And then, of course, you've got Health Education England, who actually don't work for either the trust or us, and they supervise students as well. So there's a whole raft of sort of safety measures in place to make sure that that does not happen, or at least if it does happen, it doesn't carry on, it doesn't continue, and we support the person involved. As I say, I won't say I haven't heard of it, but I haven't heard of it in large quantities and large numbers, and all the ones I have heard of have all been addressed very firmly and very quickly.
Cool, very, very clear answer. I have a couple of questions. Well, I'm going to just interject. There's another couple of questions in the chat box, but I have a couple of questions that came to mind, which I would like to ask Jodie and Yewande. And it kind of follows on from what Joe said at the beginning, that there's lots of people here in the meeting, absolutely not everybody, but there are a lot of people here who are interested in studying medicine. And I'm like a really strong advocate for nursing as an alternative. Because I think as a course it meets the needs of and the interests of what a lot of our students, you know, the reasons why they're following a kind of healthcare related future. So my two questions are, and so I'll just ask them both at the same time. One of them is about the clinical experience you get on your course. So how much clinical experience is there and when does that start? I know you're both in second year and you've already made reference to your clinical experience, because I think that's a big difference between nursing and some medical courses, like you get involved earlier. And my second question is more specifically to Yewande, because she talked about going into nursing after having been thinking about pharmacy. And I know a lot of our students, as a backup to medicine, think about either biomed or pharmacy. And I think you said it yourself, Yewande, that in nursing, it gave you this kind of, you didn't want to do chemistry for the rest of your life, which I think a lot of our students can really sympathize with that. So I guess just if you could talk a little bit more about your decision to go into something which is a bit more patient facing through nursing, and maybe if you could just kind of expand on that a little bit more. So a little bit about clinical experience and a little bit about that choice to work patient facing instead of biomed or pharmacy.
If you don't mind, I'll answer the first part of it, because what your students will go into is slightly different to what the guys here are doing. Okay. Because the curriculum changes every 5 years. It has to. It's a regulation. So Joanda and Jody are on what we call the 2016 curriculum, and the new curriculum 2020 started in September because of some changes to the NMC regulations. So we, not just us, but all universities had to update. Basically, the years are split into 2 modules, theoretical modules per year, and so there's 6 modules in total in the 3 years, or 8 if you do the 4-year course. And there's one long, what we call a long thin module, which runs alongside that, which is the practice module. So you will probably be in university for around about 8 to 12 weeks in the first instance, and then from there on in you will go out into practice, and you will be out in practice intermittently throughout the rest of the time. Coming back in from module 2, for instance, which will happen around about 6 months into the course, and then following module 2, you'll go back out to your core placement, which is slightly different to what the guys are doing, because their theory and practice is tied to one module. So this is slight variation on what's happened. But even so, the regulations for the NMC state that there has to be a 50-50 split. So it's 50% theory, which is either university, lecture, group work, skills, self-directed work, preparation for exams, preparation for coursework, or there is practice. And practice is 37.5 hours per week for the duration of the practice. And they have to complete a minimum of 2,300 hours of practice within the 3 years of the program to be able to qualify. We have got a little bit more than that, but not a lot more than that in the leeway. So effectively, 50% of each year will be done out in practice, working with real nurses, in real patients, in real situations. I'll hand back over to you, Joanda, for the next bit.
Oh, hi. How can I answer this? So basically, I got in for pharmacology and results day last year. I got in and everything, but then I think it was 2 days after where I was just like, am I sure about this, like, chemistry for the rest of my life? And then that's when I decided, I don't think I can do this. So I had to quickly like call up other unis, go through clearing, like decline my place and just see what else I could do. And I just felt like I wanted to do something healthcare related. Like I was always going to go down like the Bachelor of Science route. So I was just like, midwifery maybe. And then I was just like, I just didn't feel like that was for me. So I was just like, maybe let me do adult nursing, because I think I would have preferred adult to child anyway, just because I feel like you got to get a lot more options in adult. For me anyways, I got a lot more options because it's a wider age range, so you're going to see a lot more going on in the patient, if you understand. So yeah, I'd say I preferred adult. I mean, not everyone would want to go down the nursing route, so because it is quite different to pharmacy, but I'd say if you're doing medicine, you could go to. I've seen a lot of people that do medicine at first and then they change to nursing, but I would say it's going to be quite different because doctors, they're with the patient for a lot less time than the nurses. The nurses really build a strong relationship with the patients. That's why it's always so sad to see them leaving when they're ready to be discharged. But yeah, that's what I'd say. Maybe you should look into maybe paramedics, I'd say, because I've got a lot of friends that are paramedics at the uni as well. And I'd say maybe paramedics is a lot closer to medicine than nursing is, personally.
Okay. Can I just chip in a bit there as well? My last clinical role, as I mentioned earlier, was a manager, but the one before that, I was a charge nurse and an emergency nurse practitioner. And what that meant was I had my own caseload. So I would see patients that were directed to me in A&E through triage. And if they fit a set of criteria, I would treat, manage, discharge them. They never got as far as a doctor. So you still have those, you know, as you become more experienced as a nurse and you go up the career ladder, there are diagnostics and treatment options available to you as a nurse as well as a doctor. I was a lot quicker than the junior doctors by virtue of experience and knowledge, because a lot of the junior doctors who were seeing those patients in the A&E department were basically junior doctors, very junior doctors, whereas the nurse practitioners had a lot more experience. So depending in what field you want to go into, there are nurse practitioners right across the NHS, and that is also an option if you want to pursue that diagnostics and treatment route as well as the nursing route. Now, the other difference, of course, is nursing is a 3-year program, and as we've just said, you'll be working with patients almost immediately. Doctors is a 5-year program. It's actually more likely a 6-year program, because once you pass all the exams, there's a pre-registration year as well, which you have to attend. In my day, they used to call them house officers. So they were working on the wards full time, working for a consultant, but they weren't able to make much in the way of decisions. They used to run around following the doctors around. So it's not to become a senior house officer. That it's again, you'll be for 3 years before you can actually start making decisions about the management and the care of your patients. And then once you've finished your SHO period, you then get an opportunity to become what's called a specialist registrar. And that allows you to specialize in a particular field of medicine, and results in another qualification, which will be FRCS, which is Fellow of the Royal College of Surgeons, or MRCP, which is Member of the Royal College of Physicians, or MRCGP, which is Member of the Royal College of General Practitioners, as well as radiologists and all sorts of other things. So it'll be probably about 8 to 10 years before you get the opportunity to start to be a doctor, if you like, in your own right. And you'll have that. If you're a surgeon, you become a mister. If you're a physician, you're still a doctor. There's a whole lot of historical politics involved in that. It's more but basically, if you're looking for nursing, as both Leon and I have said, you've got a much broader opportunity in what you're doing. I'm not knocking doctors. We do need new doctors as well. So if any of you are wanting to have the staying power to do that, absolutely go for it. But nursing gives you an opportunity as well. Don't discount it, is what I'm saying.
And I think Yowanda's point was really important for people to take away, which is about how much patient time you have. So people who are interested in healthcare because they want to work with patients and they want to make people feel better and they want to help people, nurses are the ones who spend that time with patients, are the ones who form those patient interactions in a way that doctors don't get the opportunity to. So thank you for pointing that out, Yowanda. I have another couple of questions. I think we've kind of answered one of Joe's questions about are there opportunities for nurses to diagnose patients. We've had that. Adam has asked, which I think we can ask to Jodie and Yowanda as well, how do you keep your mental health in check? And Adam has qualified that by saying while dealing with severely ill patients, dementia, for example. But actually, I think we can also expand that to how do you keep your mental health in check while studying a very demanding course when you're in hospital and dealing with all sorts of difficult scenarios. And also, Adam has said, how has COVID-19 impacted on you?
I can answer that question. So for me personally, I was okay at first when COVID-19 started, but for some reason I started to become very anxious to go back in practice and all of that. But what I must say is support is there. So if you need help, try and reach out to someone. You have the university, you have your personal lecturers, they're always available for support, the well-being team, family, friends, and also try to find ways of calming yourself down, meditating, try and find all sorts of coping mechanisms to, cope with whatever you're going through, really. Because what I must say is that this COVID-19 has impacted all of us in some sort of way. So whatever we might be going through, we just have to remember that, we're not alone and there are others out there that are also experiencing things. So it's just trying to get through it, really. But yeah.
Also, I'd say to download the Headspace app. That really helps for me, like with like anxiety and stuff like that. And it's a free app, so that would be worth it, I'd say.
Yeah, I was just about to suggest that. That's a really good. It is a very good resource that you can use. Yeah.
All right, we have a few other questions. One, A slightly controversial one, but you can probably answer it quite quickly. From Ziad, who asks, is working in the private healthcare sector better for staff than working for the NHS?
It's a difficult one, that one, because I have worked in the private sector for a period of time, briefly. I didn't have such a great experience, but that was my experience. It isn't the usual. Girls, one of you said you'd worked in the private sector. What was it like there?
Oh, the private hospital. Yeah, I feel like it wasn't as close knit as the NHS hospitals. The staff aren't as, not friendly, but they're just not as close. So like sometimes you'd get some staff that meet up and go out on the weekends, but you don't get that in like the private. They're not as close.
Yeah. I have to add, my experience was nearly 30 years ago, so it doesn't really kind of hold any water these days. I mean, basically, they all follow the same regulations, because private sector, public sector, they're all following the NMC regulations. Just because you don't work for the NHS doesn't mean you're not part of the NMC. So as far as the care that's delivered is concerned, I would say there's not an awful lot of difference. The ethos of the organisations, depending on who you work, there are some very excellent private sector areas out there. There are some who are, what's the word I'm looking for? They're in it for the financial. It's a business, and I don't mean that nastily. It is a business, and they wouldn't undertake a business that wasn't profitable. So you are looking at the instead of giving 2 paracetamol, you're giving 2 paracetamol and making sure you write it down so that we can bill a patient for it. Things like that. It is important because, I say, it is a genuine business. So I'm not criticising them for that, but it's a different ethos. Some people, again, suit themselves more to the private sector. Some people will suit more to the NHS. It just depends on where it is you see your career going.
And Sila has a question, which is which I'm going to add to slightly as well. So Sila's question is, how much communication is there between nurses and physicians? And I think I would like to add to that by, you're part of this multidisciplinary team. So how easy is it to communicate between all the people who contribute towards patient care? And then maybe to the students as well. As nursing students, do you train with other healthcare professionals? So are you working together as part of your training?
The first part of that is, it's a different world to the one that I kind of joined when I was a student nurse back in the day. I think the ethos, again, of the whole NHS has developed over that time. And we see an awful, especially with the new junior doctors coming out, there's an awful lot closer relationship, I think, between the professions now than there was back in my day when I was a student nurse. But yeah, the communication lines are there because I think it's largely because of the way that nursing has developed. These days, we are a full-fledged profession with an academic qualification. Back when I was a student nurse, I qualified, I had my registration, and that was it. So they were still that doctor's handmaiden approach back in the 80s, whereas now it's much more of a collaborative approach all the way. And it's not just doctors and nurses, it's across all the professions, and we have many of them in the NHS now. It isn't just doctors and nurses. Say we've got physios, we've got occupational therapists, speech therapists, radiographers, phlebotomists. They're all professionals in their own right. They're all registered with the allied health professions, the NMC, or the GNC, which is the General Nurse. The BMA, rather, British Medical Association. So it's much closer these days than it ever was. And doctors listen to nurses, and nurses listen to doctors. It's the best way forward, because at the end of the day, there's a patient at the end of this, and this is what the reason why we all do what we do, is not for our own self-gratification, but because there's a patient there, and that patient needs all of us, not just one of us. So I think the recognition of that communication now is an awful lot stronger than it used to be back in my day. Sorry, what was the second part of that question? I've lost track now. I tend to go off on a tangent.
Whether you train with other healthcare professionals as part of your training.
It depends on the site you're on. We do have a medical school in Essex, on the Essex campus. We don't have one in Cambridge, and we don't at the moment. But part of the new curriculum is we're trying to develop some shared learning with the doctors as well. And I think that will only strengthen those interactions. But we also have the paramedics, I think, as Joanda mentioned earlier on. And we do work with the paramedics in certain areas. We try to put in interpersonal study days on from time to time as well. It's not as good as I and my colleagues would like it at the moment, but we are working towards that sort of thing. It's baby steps, I'm afraid. And as I say, the last 9 months have thrown a major spanner in those works.
Jodie and Yuande, how much contact do you have with other healthcare professionals and like student healthcare professionals, and how easy are those interactions for you?
Personally, being on placement, you do get the opportunity to work alongside other members of the multidisciplinary team. For me, I've been with like dietitians, healthcare assistants, physiotherapists. So you do get exposed to different areas, and there's always a lot to learn. What I would say is everyone has something to offer, and you will always learn from someone, really. So yeah, there is opportunity out there for that.
While it might not be built into that particular learning outcomes for that particular placement, if opportunities arrive, the staff in the wards are normally very good. If you want to say, oh, can I go and spend some time with the infection control team? They'll go, yeah, sure, of course. Let's put it in the off duty, and we'll organise a day for you. So even if it isn't built in, and some of these things are built in, they're called spoke placements. Then there's the opportunity, if something's cropping up that you're really interested in, to go and learn a little bit more about it. Then the staff are usually more than happy to accommodate you.
Well, thank you. We've sort of run out of time, but there's just one quick question which has come in, which comes up every time, and students are definitely interested in it. So I say quick question, but it might not be. Aziad is asking how easy it is to get work experience in the NHS.
It isn't as easy as we'd like it to be, and the reason for that isn't because somebody's being difficult. There are regulations that we have to abide by. And again, that can be sometimes age related if the person is under 18, or it could be the area that we're working in. Because of the nature of some of the things that used to go on in my area, we would never allow work experience on the shop floor, although we would have them in reception and we'd have them in the department, but they wouldn't be in the clinical areas because of the nature of some of the things that go on there. You've got patient confidentiality, etc., to take into account. And as they're not employed by the trust, they're not necessarily bound by the regulations that the rest of the workforce are. So there are technical problems. We used to let students and people go out with the ambulance service, and then we ran into problems with insurance. So there's a lot of bureaucracy involved that is there for a very solid and sensible reason. But the best way to get to get healthcare experience is really to go along to the local hospitals wherever you happen to be living, speak to their HR department, because there are volunteer services which you can do, and that is, say, helping on the wards with possibly patient feeding or something like that. So there are people who go in at lunchtimes and help with the patient's feeding, because some patients can't feed themselves. There's also the opportunity to do very sort of part-time, even if it's only 1 day a week, as a healthcare assistant, for which obviously you'll be paid. So there are opportunities where you can get your foot in the door if you want to, but you do have to be on some sort of contract with the trust. It's not something we can generally organise from the university point of view. And I guess the same sort of problems you may have trying to do it from a college point of view. Some areas are more than happy to take work experience, but where there's clinical patients involved, it does become a lot more difficult because of this confidentiality. Anything else I can do for anybody today?
I think we've already run over time, so I think I think we kind of have to draw a line under it there. Although that's fine, it's fine, absolutely fine. I mean, there's a bunch of questions that I would have asked. I'm sure there's a lot more stuff we could continue to talk about, but thank you very much for that, Ian and Jodie and Yuande, for giving us a huge amount of information about what it means to study nursing and to work in nursing. I think this is probably career, which there's quite a bit of misunderstanding about what exactly is involved in that. And I think listening to all three of you speak has really clarified a lot of those things, a lot of issues. I think people are going away with a much clearer idea in a real positive way of what it means to study and work as a nurse. So thank you very much for that.
Yeah, no problem at all. Thank you. And if I say just one last thing I'd like to say is throw away all the stereotypes. They don't exist. Okay, so nurses are professionals. They are very driven forward individuals, all of us. So forget the stereotypes with even male female nurses. There's no stereotypes in here, so get rid of those and go in with a fresh pair of eyes. Listen, guys, thank you very, very much, and thank you for your kind words that are popping up on the chat here. If there's anything else I can do for you, my email address is ian.mann, ian.mann, @anglia.ac.uk. Sorry, ARU.ac.uk. We changed it last year, and